Hi guys, so today we're going to look a little bit in our Form 2 revision series at AIDS, and it is categorized under diseases in the Form 2 syllabus. So let me talk a little bit about AIDS. We firstly identify what AIDS stands for. It's an acronym and it means Acquired Immune Deficiency Syndrome, right? And it of course is the final stage in an HIV infection. So you will find that when you talk about AIDS, it's mainly as a consequence of a virus, which is kind of opposite to what we just looked at in the previous video as a cause of a football illness, salmonellosis. All right, so it's caused by a virus and it's basically transmitted as a STD, sexually transmitted disease. You do, however, have it being transmitted as well in blood. All right, if you have a blood transfusion. And what you'll find is that a couple of years ago, there was an epidemic in the world in different countries, and you will see that the disease was introduced by the virus, human immunodeficiency virus, or HIV. So HIV has been found to be in saliva, tears, the nervous system, blood, semen, breast milk, and it's basically categorized as an infectious disease. So when we talk about the transmission of the contact, it could be sexually, it could be through blood transfusions, or it could be in pregnancy, where a pregnant woman can possibly transmit the virus, or nursing, through nursing as well, to her baby. All right, so it's not spread by casual contact, it is transmission through fluids. Okay, now to this day, they really have not had a cure for AIDS, but there have been drugs that have been used to treat it. All right, so you will find that patients with it, it leads to a compromising of your immune system, and that is how it leads to you getting sick, basically, right? So the patients with AIDS have had their immune system depleted by the virus. So any disease that passes, they are very susceptible to it. And because of that, it can lead to them dying. So it's really treated through a cocktail of drugs, and the purpose of the drugs, because there is no cure at this time, the purpose of the drugs is to deplete the replication of the HIV virus. So what they call is like antiretroviral therapy, where they have a series of drugs that are basically passed into the system to help to improve your white blood cell count, which is used to secrete antibodies and help your body against any kind of infection.